Hi, good morning. My name is Kavita. I'm one of the nursing master students from Grand Canyon University. What's your name?
Meera Nair,
Yeah, okay, what's your date of birth?
11/28/1978.
Okay, what bring you to the hospital today?
I came for the annual physical examination
Okay, when was your last physical examination done?
last August.
Oh, did you find any abnormal findings from last
No.
physical? Do you have any chronic illness?
No.
Do you have any psychiatric problems like anxiety, depression, anything?
No.
Any allergies to medication or
No.
environmental allergies?
No.
Okay. You take any over-the-counter medications?
Sometimes some Tylenol for headache. Other than that, nothing.
Okay. You had any surgeries done in the past?
No.
Any infectious disease like HIV, AIDS, or hepatitis C?
Nothing.
Okay. And you had any hospitalization prior?
No.
Okay. How about your immunizations? Are your immunizations are up to date?
So far, everything is up to date.
Okay.
I had my flu vaccine and COVID vaccine.
Okay, very good. Okay. And how about your mammogram and pap smear? You had your mammogram and pap
I
smear?
had done in last May.
Okay. You do your self-breast examinations? Or?
Yes.
Okay. You've been taught about it?
Yes.
Okay. If it is a male patient, I will ask about the monthly testicular examination. Okay. I have some personal questions to ask you. Are you being sexually active?
Yes.
How many partners you have in the past?
Only one.
Okay. You use any contraceptives?
Nothing.
Okay. You have any history of sexually transmitted disease?
No.
Okay. You married?
Yes.
Okay. How many kids you have?
Only one.
Okay. Do you have normal delivery or cesarean
Normal.
delivery? Normal. Oh, pretty good. Okay, let me ask about something about your family history. Okay. Any family problems of chronic illness?
Nothing.
How about your parents? Your mom is alive?
My mom is alive. She is 70-year-old. She
She
doesn't
has
have
any-
no chronic illness.
Okay.
She's healthy.
Okay.
And
How
my
about her
father?
parents?
Her parents is also her dad and mom passed away.
Okay.
Yeah.
Did they pass of any abnormal problems or?
No, like age-related problems.
Okay.
Nothing.
How about your father? Is he
My
alive?
father is 75-year-old.
Any medical problems?
No, nothing. So
Okay. His parents are okay or?
No, his parents also passed away.
Okay. How about your kids? Are they healthy?
Yes.
Okay. And no problems.
No.
Oh, how many siblings do you have?
None.
Okay. Okay. So let me ask about your some system-wise questions.
Sure.
Okay. You have any hearing problems?
No.
Okay. Any discharge from your ear? Any history of family history of deafness?
No.
Okay. Any family history of blindness?
Nothing.
Okay. Any nose problems or throat problems in your family?
No.
Okay. Any neurological problems
No.
like Parkinson's or seizures? No. Any hypertension, high cholesterol, anything in your family?
No.
Okay. Any COPD or asthma?
No.
Okay. Any Crohn's disease or bladder problems?
No.
Any endocrine problems like diabetes or any thyroid disease?
No.
Okay. Any arthritis or gout?
No.
Any obesity in your family?
No. I'm a little obese for about my age, but
Okay.
I
Any
like
history of cancer in your family?
no.
Okay. Any bleeding disorders in your family?
No.
Okay. Any mental issues or genetic problems in your family?
No.
Okay. Any do you have any substance abuse problems?
No.
Okay. Okay, let me ask about some social history. Where did you born?
In India.
Okay. So you are an Asian. Okay. As you said, you are married. And what's your occupation?
Nurse.
Okay. Do you have any military experiences?
Nothing.
Okay. What's your socioeconomic status? Everything okay?
Yeah.
Okay, you're financially stable.
So far.
Where do you live? You
I
are
live in
living
a
at.
private
Okay. Okay. What are your hobbies?
Sometimes I'll play badminton
Okay.
and reading.
Oh. Do you concerned about any safety issues in your home, any violence or anything in your home?
Nothing so far, thankful.
How you manage your stress and emotions?
Sometimes I will hear music.
How is your sleeping habits? You sleep regularly?
Yes.
Any sleeping disorders?
No.
How about your diet? Any special diet that you have to follow?
No. Usually vegetarian diet I prefer, but other than that, no restrictions.
Do you drink so much coffee in a day?
No, maybe 1 or 2 cups.
Okay. How about your exercise? Do you exercise regularly?
Not too much, but I will walk. Try to walk like daily, like at least like 15 minutes.
Okay. Do you smoke?
No.
Drink alcohol?
No.
Use any illicit drugs?
No.
Okay, let me ask about some system review questions, okay? How is your overall health?
So far I'm okay.
Okay, do you have any eye problems, pain, discharge or anything from the eye? You notice any hearing changes or discharge from your ear?
No.
Okay. You have, how about your nose? Any runny nose or smell problems?
No.
Okay. And your mouth, you have any sore throat, any oral problems, swallowing problems?
No.
Okay. Any chest pain or heart palpitations or fluttering?
No.
Okay. Any shortness of breath or cough or anything?
No.
Okay. And you said your bowel habits are normal. Any constipation?
No.
Your bowel habits are normal. You go to bathroom every day. And
Yes.
when was your last bowel movement?
This morning.
Okay. How you describe? Is it normal?
It is soft.
Any urinary problems like pain on urination or blood in urine, anything like that?
Nothing.
Any abdominal discharge that you noticed?
No.
Okay. You have any painful joints?
No.
Okay. Any muscle cramps or muscle pain?
Nothing. So far.
Okay. You notice any skin rashes or bruising or nodules on your skin? Okay. You have any depression, anxiety, or sleep problems?
No.
Okay. So when we come to your endocrine system, do you feel any hot or cold recently?
No.
Okay. Any weight changes in last 3 months?
No.
Okay. Any hair loss that you noticed recently? Any bruising or any skin problems that you've seen recently?
No.
Okay. Any lymph node enlargements that you've seen?
Nothing.
Okay. You have any allergies to any medications or environmental allergies?
No.
Let me wash my hands. Okay. Now I'm going to do the physical part of the examination. Sitting in front of me, a 43-year-old Indian female who is well groomed, dressed appropriately for the exam. She came in here with steady gait and she's alert oriented ×3 and dressed appropriately for the weather. Okay. At this point, I'll take the vital signs, height and weight and Snellen star. Snellen star will help us to cover cranial nerve 2, which is optic. Let me start inspecting your head. Your hair is equally distributed, no abnormalities noted, head is normocephalic, no inhabitants or alopecia noted. Upon palpation, no masses or relations noted. Okay. Let me do the examination of your face. Can you please remove your mask?
Sure.
Okay. I'm going to palpate for your sinuses, your frontal sinus and your maxillary sinus. While I'm touching, do you feel any tenderness?
No.
Okay. Let me feel for your temporal arteries. Temporal arteries are present. Okay. Let me touch your both sides of the face. Do you feel it?
Yeah.
Okay. I'm going to do a TMJ examination. Can you open and close your mouth? No TMJ abnormalities noted. Can you smile and raise your eyebrows? Okay. This covers cranial nerve 5 and 7, which is trigeminal and facial, which are normal. Okay, now I'm looking at your eyes. Eyelids are normal, not drooping, nodded. Sclera is white and conjunctiva is pink. Now we are going to do the ophthalmoscopy. Using the ophthalmoscope to do your eye exam. Just follow my instructions as I tell you to do. First, we are going to check the 6 cardinal gazes. Just keep looking at the instrument. Okay. This covers cranial nerve 3, 4, and 6, which is oculomotor, trochlear, and abducens, which are normal. Let me check your eyes for parallel. Okay. People are round, reactive, and reactive to light and good accommodation. And optic disc is normal and vessels are present. And I will do the same exam on the other eye too. Okay, now I'm going to check your ears. While inspecting, I don't see any abnormalities, no redness noted. When I'm touching, do you feel any tenderness?
No.
Okay. So we will do, if you test, we will do some tests for hearing, whisper test, Weber test, and Rene test. When I do the whisper test, you just repeat what you are hearing.
Great. Yellow.
Okay, which is very good. Yeah, let me do the Rene test. When I do the Rene test, I'm going to use this tuning fork. I'm going to vibrate the tuning fork and put behind your ear. When you stop hearing the vibration, you let me know. Then I'll put the tuning fork in front of your ear. When you stop hearing the vibration, you let me know. Okay, which seems good, and I will repeat the test on the other ear too. Okay, next is the Weber test. In this test, I will vibrate the tuning fork and put it in front on the top of your head. When you're supposed to hear equally on both ear. If you have any problem, you let me know. You hear equally on both ears?
Yes, I can hear.
Okay. Looks like your hearing test is normal. Okay. Let me use the otoscope and check your ear. Okay. No abnormalities noted, no discharge noted. The tympanic membrane is intact. The cone of light is present. I will repeat the same test on the other ear.
Okay.
Okay, let me inspect your nose. No abnormalities noted. Nose is in midline. Let me use the light and inspect your nose. Okay. Oh, the nasal mucosa is pink and moist, and no central deviation noted, and no masses, no discharges noted. Let me do a smell test for you. Can you close your eyes? Okay, can you tell me what you smell like? Okay, that's true, and your this covers the cranial nerve 1, which is olfactory, which is intact. Let me do check your nose again. Can you close one side of the nostril and breathe in and out through the other nostril? Okay, do the other side. Okay, which is normal. Okay, now I'm going to inspect your mouth. Okay. Can you open your mouth and say ah? Okay. Tonsils are looking normal, or mucosa is pink and moist. Anterior and posterior pillars are noted. No loose teeth noted. Okay. Now, can you stick your tongue out? Can you move side to side? Okay. This covers cranial nerve 9, 10, and 12, which is glossopharyngeal, vagus, and hypoglossal, which are intact. Okay, let me inspect your neck. Your neck looks normal and symmetrical. No masses or lesions noted, and I can feel your trachea in central. Can you shrug your shoulders? Okay, it looks normal. This one covers cranial nerve 11, which is spinal accessory. Okay. No jugular vein distension noted. Let me feel for the thyroid when I ask you to do it. Just can you swallow? Can you swallow? Okay. No goiter or nodules noted. Okay. Let me palpate for the lymph nodes. No palpable lymph nodes are noted, which is good. Okay, moving on to the inspection of the thorax. In a normal setting, I will ask the patient to remove the clothes. Okay, let me inspect the thorax. Upon inspection, no abnormalities noted, no hernia or masses noted. And now I'm going to palpate your sternum for any tenderness. While I'm touching, do you have any tenderness?
No.
Okay. Okay. Skin is hydrated and patient, you have very good skin turgor. Okay, let me auscultate for the lung sounds. Okay. Can you please take a deep breath in and out? Okay, lung sounds are clear. Okay, let me ask you, do you do your monthly self breast examination?
Yes.
Okay, you haven't thought about it. Okay. Can you turn to this side? Let me check your anterior posterior diameter. Thank you. Okay, the anterior posterior diameter is 2 to 1. Okay, moving on to the back of your back exam. Can you move your hair? Okay. Upon inspection of the back, I don't see any abnormalities. The skin is intact. You have good skin turgor. While palpating, do you have any tenderness?
No.
Okay, let me look for the lung expansion. Can you please take a deep breath in and out? Again. Again. One more time. Again. Lung expansion is normal. Okay. Now we are going to look for the tactile premitus. When I tell you to say 99, can you say 99? Say 99.
99. 99. 99.
Yeah.
99. 99.
Okay. Thank you. Going to purpose your lungs. Okay. I hear a resonance which is normal. Now I'm going to do the diaphragmatic excursion. Okay. Can you please take a deep breath in and out and hold. Okay. Breathe normally. Okay. Now can you take a deep breath in and hold. Okay, now this is like 3 to 5 centimeter, which is normal. Let me auscultate for your lung sounds at the back. Take a deep breath in and out. Okay, in and out. One more. In and out. Okay. I hear normal lung sounds, which is good. Thank you. Okay, I'm going to do the same exam on the front of your body. I'm going to inspect your thorax, palpate for any abnormalities, and I'll look for lung expansion, tactile premitus, and percus, and auscultate for any abnormal breath sounds. Let me do the cardiac examination now. I'm going to look for any heaves, lifts, or thrills. I don't see any. Let me palpate for the apical impulse. I felt the apical impulse. Let me auscultate for the carotid fluid. Let me repeat this with the bell of the stethoscope. Let me auscultate for the heart sounds now, using the mnemonics. Aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to repeat the same with the bell of the stethoscope. Aortic, pulmonic, Erb's point, tricuspid, and mitral. I don't hear any abdominal heart sound or murmurs. All I'm hearing is S1 and S2. Now I'm asking you to lay back on the bed. Okay. While you laying back on the bed, let me look for the jugular vein pulsation. I don't see any. At this time, I will auscultate for the heart sounds using the mnemonics. I'm going to use the diaphragm and the bell of the stethoscope to listen to your heart sounds. And I don't hear any. All I'm hearing is S1 and S2. Okay. And at this time, I'm asking you to turn your head to the left side. And when you turn into the head to the left side, I'm going to check for the jugular vein pulsation, and I will measure the jugular vein pressure. Let me inspect your abdomen. I'm inspecting for any hernia, scars, or any masses. I don't see any. I'm going to auscultate your abdomen this time. Let me auscultate all 4 quadrants in 2 places. All I'm hearing is normal bowel sounds. Let me auscultate for the arteries in your abdomen. Abdominal aorta, renal artery, iliac arteries, and femoral arteries. Let me repeat with this test with the bell, abdominal aorta, renal arteries, iliac arteries, and femoral arteries. I don't hear any problems. Let me percuss your abdomen. I'm going to percuss all 4 quadrants in 2 places. I don't hear any abdominal sounds. All I'm hearing is abdomen. Okay. Let me go ahead and palpate. Okay. Let me know if you have any tenderness. Do you have any tenderness?
No.
I don't feel any hernias or masses. Okay, which is normal. Okay, now Let me check the McBurney's point for your abdominal pain. Can you take a deep breath in and out? Okay, do you have any pain? Okay, let me do some deeper palpation. I don't feel any masses or hernias. Okay, let me do a saw side. Okay, can you lift up your leg while I'm applying some pressure on your leg? Can you lift up? Okay, do you feel any abdominal pain?
No.
Good, thank you. Okay, let me percuss your liver. Okay, liver spine noted. Let me palpate your liver. Can you take a deep breath and in and out? Okay. No liver drop noted or no liver enlargement noted, no hepatinomegaly noted. Okay. Let me purpose for your spleen now. I'm going to palpate your spleen. Spleen is not palpable, which is normal. I'm going to palpate for the abdominal aorta now. No masses or pulsations present. Okay, now I'm going to palpate for your kidneys using the tactile method. Can you take a deep breath in and out? I don't feel any kidney. Let me repeat the same exam on the other side too. Take a deep breath in and out. I cannot feel any kidneys, which is normal. Now I'm going to palpate for your for any femoral lymph nodes and inguinal hernias, which is not felt, which is normal. Oh, okay. Now I am asking you to sit up. Can you come and sit down on this chair? Okay. Can you just turn to the other side? Okay. Now just move your head a little bit. Okay. Now I'm going to assess for the CVA tenderness. You let me know if you have any pain. Do you have any pain?
No.
Okay. Now let me inspect. Now since you're turning to the right, let me inspect your spine. Okay. Can you bend forward? Any tenderness?
No.
No. Okay. Now I'm looking for any kyphosis or scoliosis, which is not noted, and no spinal tenderness noted. Can you just turn to this side? Okay. Okay. Now I'm going to do the exam of your cervical spine. Can you move your head side to side? Okay. Up and down.
Feel back.
Okay. Move your head to the shoulder, both sides. Okay. Do you feel any pain or tenderness?
No.
Okay. And I didn't feel any crepitus, which is normal. Okay. Now I'm going to check your shoulders. Let me inspect your shoulders. I don't see any abnormalities. Can you lift your arms to the sideways? Okay, put it down. Lift both arms forward and down. Do you have any tenderness?
No.
Any pain?
No.
Okay, and no crepitus noted. Now I'm going to ask you to move your arms like this and down. Okay. Let me look for the strength of your arm. Okay. Give some resistance. Let me inspect your elbow. No, is noted. Can you bend your elbow? Okay, straighten it out. No abnormalities noted. Do you have any pain or tenderness? No. Okay. Let me check it on the other side. Okay. Moving to the wrist, can you move your wrist down and up? Okay. Move your wrist up and down. Okay. And rotate your wrist. Okay. Any pain or tenderness?
No.
Okay. Now moving to the fingers. Can you bend your fingers and open it up? Can you spread your fingers and close? Okay. Now I'm going to check for the strength of your arm. While I'm putting pressure, can you lift your arm up? Okay. Lift your arm down. Okay. Let me check for the strength in here. Okay. Can you give pressure down? Okay. Can you give pressure up? Okay. Okay. Spread your fingers and close. Okay. Everything looks good. The strength is good and no swelling or edema noted. I'm going to repeat the same test on the other side too. Oh, okay. Now I'm going to check for the arteries in your upper extremity. Let me check for the pulses. The radial pulse, which is +2, ulnar, which is present, and brachial pulse, which is present. Now let me check for the sensitivity on your upper extremity. I'm going to use this, and when you feel sharp or dull, you let me know. Can you please close your eyes?
Sharp.
Okay, where is it?
Left upper arm. Dull. Left lower arm. Sharp. Right lower arm. Dull. Right upper arm.
Okay, very good. Okay, you have good sensation. Okay, moving on to the reflexes on your upper extremity. Let me check the reflexes on your upper extremity. First, I'm going to check the reflexes on the triceps. Okay, biceps and brachioradialis. I'm going to repeat this test on the other side too. All the reflexes are normal. Okay.
Okay.
Okay. Now I'm going to assess the strength of your lower extremity. When I apply pressure, you just give some pressure upwards. Very good. And this leg? Okay. Okay. This lower part. Good. And here? Good. Okay. Can you put some pressure upwards? Okay. Very good. And this one? Okay. Very good. Okay. Let me assess for the pulses in your lower extremity. Popliteal pulse, which is present. Dorsalis pedis, very good. Posterior tibia, which is present. I'm gonna do the same exam on the other leg too. Okay, and let me do some reflexes on your lower extremities. Patellar reflex, which is good. Actually, sternal reflex, which is good. I'm going to do the same reflex exam on your other leg too. Okay. Now I'm going to do a sensitivity test on your lower extremity. Same as we did it on the upper extremity. When you feel, you gonna tell me what you feel.
Okay.
Close your eyes.
Dull.
Where?
Left upper leg.
Okay.
Sharp. Left lower leg. Sharp right lower leg. Dull right upper leg.
Okay, very good. You passed the test. Okay, now I ask you to stand up. Okay, can you extend your both arms to the sides? Okay, bring it down to the front and bring it down. And can you turn to this way and bend forward and touch your feet? Okay, while you are doing that, I'm assessing your spine for any kyphosis or scoliosis. Okay, there. And no tenderness. Do you have any tenderness?
No.
Okay. Okay, no kyphosis or scoliosis present. Okay. Can you lift your lower extremity. Bend your lower extremity. Okay. Can you bend the other lower extremity? Okay. Now I ask you, and now I ask you to rotate your ankle. Okay. The other ankle. Okay. Very good. Can you walk to the wall and come back? Okay. Very good, Meera. You are walking with good coordination and balance. This concludes our physical examination. Thank you very much for your cooperation.